Assalamualaikum doctors. In this video I am discussing about brain tumor history management. So history already I tell. Management, for some information I am telling. First of all, brain tumor in children are almost always primary rather than metastatic. Okay. 60% are infratentorial, that is located below the tentorium cerebelli. So supratentorial, infratentorial, among them 60% are infratentorial, which are location between below the tentorium cerebelli. So cerebelli below. They are the most common solid tumor in children and are the leading cause of childhood cancer death in the UK. Type of brain tumor, if they ask some brain tumor name, tell us. So astrocytoma 40%, medulloblastoma 20%. These are most common. Astrocytoma, medulloblastoma, ependymoma, brainstem glioma, craniopharyngioma, and typical tumor. So astrocytoma, medulloblastoma, ependymoma, then brainstem glioma, craniopharyngioma. So there are four grades of tumor. Number one grade, there are mainly two main types of brain tumor. Non-cancerous or benign brain tumor. These are the low grade, grade 1 and grade 2, which means they grow slowly and are less likely to return after treatment. So grade 1, grade 2 are benign. Cancerous malignant brain tumor are, these are the high grade tumor, grade 3 and grade 4 are either start in the brain primary tumor or spread into the brain from elsewhere. Secondary tumor, they are more likely to grow back after tumor. Okay, so they positive tumor grade 3, grade 4 in treatment. The symptoms include of brain tumor are, what are the features we find? First of all, headache, which does not subside from over-the-counter medications. Good weakness in the limb, face or one side of the body, impaired coordinations, difficulty while walking, difficulty in routine activities like reading and talking, noticeable changes in senses like taste and smell, bladder control problems, change in mood, personality or behavior, nausea or vomiting, and memory loss. What are the causes of risk of brain tumor are? First of all, exact cause is not known, but few of the possible causes are: number one, genetic mutations leading to uncontrolled multiplication of cells in the brain, which results in a tumor mass. Cancer in other parts of the body. The risk factor include family history, age, elderly people are at high risk of developing tumors. Okay. And exposure to chemicals and radiations. Complications. What is the complication? If untreated for a prolonged period, it may lead to, first of all, peritumoral edema, that is causes due to buildup of fluid. Okay, so edema, brain edema, seizure, depression, vision loss. Tumor mass pressing in the nerve cells to the eye can cause vision loss. Hearing loss. Tumor mass pressing in the nerve cells of the ear can cause vision loss. Then fluid buildup in the skull. So these are the complications we know: seizure, fluid buildup on the brain, hearing loss, vision loss, and depression. Common test and procedure. First of all, neurological examination. This test includes checking the vision, hearing, balance, coordination, strength, and reflexes. Then a magnetic MRI we can do. MRI provide the details about the image of the brain. Then position emission tomography. That is PET test. It reveals functioning of the brain. Then EEG is the brain electrical impulses. CT scan do check the cancer, other parts of the body, and biopsy. So what are the tests we can do? First of all, the test, neurology test, we are position, hearing, vision, these are tests. Brain MRI you can do, CT of the brain we can do. We can do position emission test, that is PET test. We can do the biopsy, EEG. So treating brain tumor. If you have a brain tumor, your treatment will depend on, number one, the type of tumor, where it is in your brain, how big it is and how far it spread, how abnormal the cells are, and your overall health and fitness. Treatment for brain tumor include, number one, steroid medicine to help with symptoms, surgery, first line treatment aiming to treat the hydrocephalus, then radiotherapy and chemotherapy. Okay, so here treatment giving first of all steroid, then surgery, radiotherapy, chemotherapy. These are our treatment. After being diagnosed with a brain tumor, steroids may be prescribed to help reduce the swelling around the tumor. Other medications can be used to help with other symptoms of brain tumor, such as anti-epileptic medicines for seizures and painkillers for headache. It's not always possible to remove all of a tumor, so further treatment with radiotherapy or chemotherapy may be needed to treat any abnormal cells left behind. Treatment for non-cancerous tumor is often successful and a full recovery is possible. What is the multidisciplinary team? I am taking physiotherapy, occupational therapy, speech and language therapy may be required to support the optimal recovery. Survivors living with disability, growth, endocrine, neuropsychological, and educational problems require complex care management. So, this is brain tumor management. Thank you.